This is Average Joe PT, where we're here to improve your function, reduce your anxiety, and master your pain. Isn't that right, Scully?
Master your pain!
Now, Scully and I would love to have you be part of our family, and if you would love this content and you like other content, go ahead and subscribe down below. Today, Scully and I, we're going to talk about the spine and different ways you can go ahead and protect your spine with activities that you should and some that you shouldn't do at home, as well as we're going to go over all types of exercises to help protect this little spine. Stay tuned. Scully and I, we're going to go over two major tips as well as some eye-opening rationale for doing some strengthening exercises for your abdominals and for your lower back. This first tip is real simple. Stay out of the C position. That's what I mean. Being a letter C. Now, see this little guy? That's the last thing you want to do when you're sitting all day long, is being a letter C. Terrible to do. You want to keep your back straight or keep your back in a nice kind of arch extended position. That's tip number one. Tip number two, that's right. You want to monitor the types of lifting as well as how heavy it is, when it's appropriate to lift, when it's appropriate to reach. Don't be trying to lift something out in front of you. That puts way too much stress on little spiny here. Squat. You always want to make sure that your knees are bent and the object is as close to you as possible, especially if it's heavier, because you got more power this way than you ever do when your elbows are out to your sides. You tuck in, you got a lot more power in here, lifting, pushing, and pulling, than you do when you all of a sudden lift your elbows away from your side. So be mindful, keep tucked in, keep an object close by your side as possible. Tip number three, this little pick right here, this is called the multifidus. It's the major muscle in your lower spine that no one talks about. They're always talking about your abdominals and the corset idea. That is true, but the one elephant in the room that they're not talking about is the good old multifidus. And the scary part is, you injure your back once, you can kind of recover from it. You know, the younger you are, the faster you can recover. That's like no duh, right, Average Joe? But when you get older, you get in those late 20s, 30s, and 40s and on up, that muscle actually, if you injure it and pull it again and strain it for a week or two, the tissue actually starts to shrink and call atrophy. And the eye-opening is you actually start to get fatty deposits inside that muscle. That's right, that muscle turns into a fatty deposit. And obviously fat is not muscle, and so it's easier to injure that spine again, as well as now you're putting a lot more stress on the spinal joint. Alright, what we also call the facet joint. I'm going to leave a little tag up here that goes over all that kind of stuff in my playlist. I went over that a while ago, so you guys can go ahead and look at that. That eye-opening experience is that good old multifidus. Now, I've lighted this up for you so you can see the different phases, all four of them, and that severe one where that muscle's really shrunk and it's more white around that area. That white around the area is fat. That's right. That's quite scary. No wonder why once you hurt your back, and if you don't do what I'm telling you, what I'm showing you, it's easy to hurt it again. Then you start having disc problems, then you start having facet joint problems, then you start having inflammation problems. It gets really scary. Next thing you know, your anxiety's up. Gee, I can't do nothing anymore. Maybe it's because I'm getting older. No, that's not the case. It's because you didn't treat it correctly. You didn't recover appropriately. So I want you to stick with me, and we're going to go over some exercises in a nice progressive form that you can go ahead and start out with and get your back strong again so you can lift, push, pull, and sit for prolonged periods without your back bothering you. I want you to look at this fool next. He's doing everything absolutely wrong, and if you're doing anything like this at home, I want you to stop doing it immediately unless you want to go see a surgeon. All right, here's where we go. We're going to go over a nice little progression to this exercise program, starting out novice or simple, going moderate, and then going extreme. Now, extreme, I'm gonna use a little ball. You can pick this up at Walmart. Pick up anywhere for probably 10, 15 bucks. This size is a 55 centimeter. Start out with something as simple as what we call a pelvic tilt. And you're literally pushing your back down into the bed, flattening out. You're gonna feel your lower and your upper abdominal muscles tighten up. You're gonna hold that 10, 15 seconds and then relax and then rinse and repeat. Once that's pretty easy, next progression is holding that down and then marching in place. After that, you're gonna move your opposite arm and leg, keeping that back flat. You wanna do this for at least 30 seconds to a minute. Really get those abdominals to burn a little bit. You really wanna take it up. Start doing the windmill kicks. Back has to stay flat though. And don't be way up here. You're out in front of you. Now, you don't want to do this unless your abdominal muscles are pretty strong. You want to kick it up even further? Don't want to do that. So, master it all the way back at the beginning where you're pushing your back down flat and you can keep it there while doing the march. You don't do any of this progression further until you've mastered the previous exercise. Next one, I'm going to show you good old-fashioned physio ball. Bring your legs right over the top. All you're going to do, arms extended or on your thighs or cross. Just going to lift up. You're gonna hold 1, 2, 3, and down. That's gonna start to engage that multifidus muscle that it's weak, it's irritated, fatigues very fast. Up, 1, 2, 3, 4, 5, and relax. You wanna make it harder? Next step, bring the ball out further to about the calf. Up, hold, 1, 2, 3, and relax. You wanna make it harder? Extend your arms. You wanna make it easier? Put them down flat and you can push off a little bit. Realize that you are pushing off and that you need to have your arms extended at some point and then back down. Back gets a little sore, just start some rocks, nice and easy. Maybe try like 30 of these just to kind of stretch out your lower back and kind of warm it up a little bit. You want to take it to the extreme, feet right on the flat part of the ball and come up. Hold 1, 2, 3, 4, 5 and relax. That's going to engage your glutes, your hamstrings, and your lower spine multifidus muscle group. You want to take it to the top level. Extend, lift the leg up, extend, lift the leg up. So you can go ahead, there's a nice little progression, and you don't do this one until you've mastered the previous one, where you can do at least probably 20, 25 of those before you move on to the next level. So those are some exercises that you can do to strengthen not only your abdominal muscles, but that multifidus muscle. Scully and I would love to have you part of our family, and we invite you to subscribe down below. I bring content, Scully and I do, once or twice a week on different ways that you can master your pain. I'm going to leave a little tag up here. This goes over all the different types of stuff that I talked about, as well as some other types of treatments that you can do, as well as maybe give you some hints for your loved ones and some other family members, and give them some ideas to help reduce their pain, improve their function, and reduce their anxiety. But until next time, we want you to look up, keep smiling. Ain't that right, Scully?
Look up, keep smiling.
He still got it, guys. See you next time.